Gynecomastia, what is that?
So this is a term that amongst lay people, some people even refer to it as man boobs, which is not a very nice or very sensitive term. Man boobs.
All right.
So breast development in men. So
All right.
today we brought a specialist, Dr. Lauren Willoughby, a plastic surgeon, to talk to us about what it is, what your choices are, and what you can do. Let's start at the beginning.
Sure. So what is gynecomastia? Gynecomastia, by definition, is a growth of breast tissue in men. So all men have breast tissue, just like all men have nipples. And in most men, that amount of breast tissue is small. But if the breast gland is large, then you would call it gynecomastia. So it's important to know that that's what the true definition of gynecomastia is, but some men also have other tissue in their breast area, like excess fatty tissue or extra skin.
Right.
And so the gland and the skin and the fat, all those things can contribute to the way a man's chest looks, or the breast area.
Okay, so trying to distinguish between true gynecomastia and just the appearance of the chest secondary to body habitus.
Yes.
Is that a challenge? How do you distinguish between the two?
So sometimes you can tell when you examine the patient. So you palpate the area, and if there's any firm, rubbery tissue, that's usually breast tissue. So you can kind of pinch the area. So there's ways you tell when you examine the patient, but you can also get imaging. So ultrasound is a really good way to see, is there a gland, and if so, what is the size, and is the size similar on both sides, or are they different?
And now when someone comes to see you or their family doctor gets referred to you, is the concern pain? Is it cosmesis? Or is it even something more serious like cancer?
So most men who are seeing a plastic surgeon are bothered about the aesthetics.
Okay.
The first thing to know about gynecomastia, like any other condition, is you have to make sure it's not caused by any underlying medical problem. And there's other medical problems that can cause it. For example, testicular cancer, certain abdominal type tumors, thyroid issues. So you have to rule those things out before you decide what you're going to do from a surgical perspective.
And that's the way we always do this, right? The history, the doctor takes a history, find out what's going on. They do a physical examination, try and determine if that's breast tissue or is it fat tissue. And then they do investigations, in this case like an ultrasound. Then we come up with a diagnosis, right? And we find out, is this gynecomastia on its own, or is this secondary to an underlying condition that could be serious and needs to be treated? And then we get to treatment options.
Before we get there, outside of the causes that are more serious, like cancer, why do people get it? Is it something they ate, something that they did? Why does it happen?
In some people, it's just bad luck, and it happens during growth during puberty. There are some other causes, like testosterone use or anabolic steroids. Marijuana can cause it as well, and there are other prescribed medications, for example, ones that control blood pressure that can cause gynecomastia.
Okay.
And in general, you want to control and stop those factors before you consider surgery.
Right, because it may be reversible.
Usually doesn't go away, unfortunately.
It'll stop progressing, I guess.
Correct, yeah.
Right. So then you have to decide if what you're left with is enough that you still want to have treatment.
Yes.
Okay.
All right, and we have mentioned that before as one of the complications of anabolic steroids in one of our videos we made about anabolic steroids. So go watch that video. So you've decided that it's caused by something that's not an underlying serious medical condition, such as a cancer or something like that, but it's there, and I want it treated, I want it removed. Is it always surgery? Are there other options?
It's always surgery for gynecomastia. And you have to break it into a couple of components. How do you remove the gland? How do you remove the fatty tissue if it's there? And is there a lot of skin, and do you have to make the skin envelope smaller? So you have to assess all of those things because they're treated differently. So to remove the gland, which all men have if they truly have gynecomastia, you need to make an incision somewhere, usually around the nipple. Some people use a remote incision and they put a little tool in to help remove the gland. So you need to surgically remove the gland. In men who have extra fatty tissue in the breast area, best way to remove that is liposuction, 100%. And then if there's extra skin, then you might consider reducing the skin envelope, although the disadvantage with that is it leaves extra scars.
Okay, so that's how you remove it. If you got it, if you can live with it, you live with it. If you can't live with it and you want it removed, you're looking at a surgical intervention of some kind to treat that.
Is this always curative? Is it possible that you could remove it and then it could come back?
It can always come back, I suppose, especially if someone engages in behaviors like anabolic steroids, like we talked about before, or if the patient gains weight and they gain more subcutaneous fat, they can get a recurrent area of thickened tissue on the breast area. So I suppose it can.
But generally speaking, pretty successful operation.
Generally, most patients just need one surgery.
And I think you could understand that this could be very anxiety-inducing or stressful for patients, so it would be very satisfying for these people to be able to have that stress removed.
It is. I always tell patients, if you look in the mirror every day and something bothers you, talk to someone about it, because there's good options out there.
Okay. Unless it's like a hat or something, then just take it off. Okay. So anytime we talk about surgery, we always talk about complications. There's risks of complications. What can go wrong with surgery to treat gynecomastia?
So you can get some asymmetries or differences between the two sides and how they look. You can get scarring. Most scars fade over time, but and rarely those scars can become thickened. The nipple sensation can go completely numb in some patients, and that might never come back. And seroma, which is fluid collection. So if you're removing a large piece of gland, it's really important after surgery the patient wears a compression garment of some type to basically squish everything together so fluid can't collect.
Wow, that's a good summary. Gynecomastia, fun to say, not fun to have, but now you know how to treat it.
Thanks so much to Dr. Willoughby for joining us and educating us.
Thanks for having me.
You're welcome. And if you like this video, please like and subscribe to our channel. Leave some comments if you've experienced gynecomastia or you've had treatment. Share it with other people because you're definitely 100% not alone.
And remember, you are in charge of your own health.
We'll see you next time.